VIMS is our incident recording or reporting system for the organisation. VIMS is Victorian Health Incident Management System. Where it draws a huge benefit over all the pre-existing systems we had is for the first time we track incident trending, frequency, severity, not only locally within the context of what's happening within our hospital, but because it's the same data set used by every other health service now within the Victorian health system, we get comparison to statewide trending. It means we can be more proactive rather than perhaps reactive to incidents. We have advanced knowledge of trends that might be emergent in areas of specialty care in, say, Melbourne or other regional areas, and they can inform our practice. It's basically an electronic system accessible to any staff member that has access to a computer here at Bendigo Health, be they here in Bendigo or any one of the remote sites, Swan Hill or Chuka. It allows nurses, doctors, non-clinical persons such as myself to enter any incident which may have affected patient safety, quality of care, as well as any occupational health and safety incident that may have occurred. There's a wide variety of reportable types of incidents. The most obvious ones fall within a broad range of medication-based incidents, falls reporting, aggression in some of our units which are specifically geared towards treating patients with conditions that might lead to aggressive behaviour. The system's well designed and it has in its origins a well-designed structure by which anyone reporting an incident, be it at 2 o'clock in the morning on a Saturday or 3 o'clock in the afternoon on a weekday, it is immediately notified not only to the manager, but any specialist group within the hospital that has a vested interest in that area of concern that the incident's highlighting. For example, if it were a blood transfusion incident, it would be reported to not only the manager of the staff member reporting it, but also to our transfusion safety nurse. It would also come to myself as a risk manager, as well as a quality consultant working within the quality unit who looks after the area of care or oversights the area of care in which the incident might have occurred. So there's multiple notifications that occur. It's far more broader than it needs to be, but that's an inherent part of the safety aspect of the program. We make sure the right person knows as soon as is possible after the incident. The system before it, where it differs, is that managers have direct access to reports about incidents occurring in their area of activity. They don't need to come to us to get that information every time they need it. They can come to us, we can tailor a report, and they then have access, live access to that information anytime they need it. All that information is still held in confidence, all the information is still controlled within our health service. However, it is far more accessible than it ever has been before. Where an incident's occurred, it is entered at the time of the incident by the nurse or doctor or other clinical person who's entering the incident into the system at any time of day or night. They use a preset calculation as to the harm that may have occurred or did actually occur. That determines the level of response within the organisation. Some incidents are viewed in what are termed aggregate terms, at unit level, by committee level, but the serious incidents where harm may have occurred or serious harm may have occurred is immediately dealt with at senior levels of the organisation, which means that notification right up to the executive level can happen very quickly and does happen very quickly. It's really a prioritisation to make sure people who need to know about it very quickly, because that drives another series of events within the organisation. We conduct investigations using accepted and known methodology in which we're trained. And that has executive backing. So the more serious the incident was, so to speak, the higher it goes within the organisation, and it's an executive who actually sponsors the investigation of that incident. The data allows us to validate perhaps concerns that are raised in one of the specialist risk management committees within the hospital, for example, our fall steering group, our transfusion safety committees, our clinical risk committees within the different areas of specialties such as medicine, surgery, psychiatric services, can validate perhaps some of the concerns they have and see if they're actually evidence in trends within the whole state. If you go back to a department like emergency and articulate to them that this is the trend we have for incidents within your department, this is now how it compares to the rest of the state of Victoria, it'll be highly informative. It'll confirm some areas that we might have already anecdotally thought were areas of concern, and it might highlight those emergent areas within health services. So we certainly see that potential. We've been using VIMS now for a year here at Bendigo Health. The advantages we've seen in the system, potential is certainly great. It being a new system with a vast scope, well beyond what we've ever dealt with before, with state-based, statewide reporting, means that it's been challenging at sometimes to introduce, but we've already seen large areas for improvement. A good example of that would be where clinical craft groups such as oncology, that is cancer treatment, or our staff specialising in diabetes education and management can tailor specific reports for their craft group that inform them about trends that are occurring both within their unit and maybe occurring elsewhere, such as an incident involving a diabetes patient who's been admitted through the emergency department. So that's allowing them for the first time to see information about trends associated with their patients and their specialty within our health system. So as it evolves as a system, we provide feedback to the department. They've been responsive to that feedback, and we've been able to gear the system to promote those benefits to the organisation. For the first time, we're using this same system to capture all feedback. So where we have a relation with the Office of the Health Services Commissioner, we now capture all data associated with our complaints in an extraordinary level of detail for any complaint or compliment that's forwarded to the organisation. So we can specifically provide feedback to our executive as to trends. Very highly informative, one of our best sources of data around incidents and management of patient quality and safety. Also means that we can inform the actual groups or the departments involved. Nice also to be able to send a compliment back to that manager and have it recorded and evidence of trending within that, that service within the unit, within Bendigo Health. We at Bendigo Health made the decision to participate in the first wave rollout of this program back in July of last year. So we were pioneers within the state for actual use of the system. We therefore have had input into the department's rollout as such. They've supported us well at the Department of Health with both online training tools for training of staff. We, within our role within the quality unit at Bendigo Health, assist staff and provide both local training to nurses and doctors at their request. We provide training materials. We'll visit any part of the organisation, be it here in Bendigo or elsewhere, to deliver that training. We provide individual coaching to managers as part of simply continually pushing information, education, and providing assistance to the actual staff in the field delivering clinical services. We've always seen the potential for better recording, and I think the department's made a quantum leap now in giving us a system that is used to capture all that information, which is light years ahead of its predecessors. Invariably they were paper-based systems like Excel spreadsheets or a simplified system.